Hello everyone, our today's topic is acute herpetic gingivostomatitis. What is meant by gingivostomatitis? Itis is the inflammation. So the gingivostomatitis is the inflammation of oral mucosa and the gingiva. It is a communicable disease. It is a communicable disease. Mostly etiology of this disease is due to the bacteria. It affects the infants or children's mostly 6 years of age. Primarily the infection is asymptomatic. Etiology is due to HSV1. So the first there is a exposure to the herbs. There will be no symptom. Primarily it is a asymptomatic. Then virus, viral etiology is there. Herpes virus is inoculated. It goes and settle down in the trigeminal ganglion. Settle down in trigeminal ganglion. Then the aggravating factors for this is the sunlight, fever, stress, then trauma, any surgical procedures, surgical procedures, systemic diseases are the aggravating factor for the AHGS, that is acute hepatic gingivostomatitis. Uh, it reactivates the latent herpes virus, so there is the secondary infection occur. Then secondary manifestation there will be herpes labialis is seen, herpes labialis, then herpetic stomatitis, herpetic genitalis, ocular infection is also there, ocular herpes, as well as a herpetic encephalitis. Herpetic encephalitis. Herpetic encephalitis is there. The most common clinical features of this is the diffuse erythematous shiny involvement of the gingiva in the mucosa. Diffused erythematous, this shiny involvement of gingiva and the mucosa. There is a edema present as well as a gingival bleeding also present. Edema and bleeding is present. First of all, the vesicles are formed. What is the vesicle? There is a pinpoint vesicles form. Vesicles means the fluid filled cavities. Then within 1 to 2 days or within the 24 hours, these vesicles are ruptured, and this ruptured vesicles looks like in the center it is look like a yellowish gray lesion, and in surrounding it is a reddish hollow present. This is the characteristic feature after the rupture of the vesicles. Then what is the symptoms? And it this vesicles, this condition is heals without the scar formation. So the symptoms of this is the it is sensitive to thermal changes. It is very painful. Irritability occurs. Then person is refused to eat. There is high fever. Then lymphadenitis, generalized malaise also present. So what is the histologic features of this? Histologically, there is an invasion of the epithelial cells with this virus. Invasion of the epithelial cells with virus. Then there is a degeneration of the cells occur. Then cells combine to form the multinucleated cells. Then this the virus destroy the cell organelles. Virus destroyed the cell organelles. Then vacuolization of epithelial cells occur. Vacuolization of epithelial cells are occurred. Then inflammatory infiltration occurs. Connective tissue will be densely infiltrated with the inflammatory cells. So, due to infiltration, there is a increased vascularity. Vascularity is increased, and in center there is a degeneration occur. So, this is the look like the yellow grayish colored lesion, and in the surrounding there is a reddish in color due to the dilated blood vessels. In this disease, the virus mainly targets the epithelial cells. There is a ballooning ballooning degeneration is present. So the T-Zank cells are seen in this acute herpetic gingivostomatitis. So what is the treatment of this? Then treatment of this is the if a patient comes to you with this condition before the 3 days of having this, then we have to give the antiviral drug to the patient. That is a cyclovir 15 mg per kg is given for 5 times daily in 7 days. 5 times for 7 days. And if patient comes to your clinic after the or more than 3 days of having this condition, then any antiviral drug you given that is not effective, so you have to treat the symptomatic symptoms first, give the symptomatic treatment. In that you have to remove the plaque, calculus, debris, give the NSAIDs for the fever and pain, give the local or systemic antibiotics for prevention of the opportunistic infection, mostly in the immunocompromised patient. You have to give the certain supportive treatment also, that is fluid, increases the fluid intake of a patient. Tell the patient about the mm, amount of fluid intake per day. Then give the patient nutritional supplement. Then topical anesthetics before eating, so it reduces the pain and burning sensation while patient eating. um, if the herpetic lesion is spread to the finger, if the herpetic lesion is spread to the finger of the patient, then this condition is called as a herpetic white low, herpetic whitlow. Mostly this condition is occur in the most of the dentist, because of the when the acute hepatic gingivostomatitis patient come into our clinic, if we treat or do OPD with bared hand, it is communicable disease. So it this lesion gets on our finger. So this condition is called as a hepatic whitlow. So be careful. If you are right about the syndrome in the university like this, in the form of a flowchart pattern, so it can help you to secure most of the marks than the other student. So keep watching. Happy study.